Hello, my name is Karen Zúñiga. My teacher is John Moscoso. I study in Catholic University of Guayaquil, School of Nursing, Saint Vincent of Paul. I am going to talk about pelvic inflammatory disease, PID. Definition is an infection induced inflammation of the female of the reproductive tract, the ovaries, endometrium, fallopian tube, or pelvic peritoneum. Inflammation spreads from the vagina or cervix to the upper genital tract, with endometritis as an intermediate stage in the parthenogenesis of disease.
Disease, ectopic pregnancy. Those are obviously severe problems that you need to rule out early. And again, when you're looking at urgent care issues, you want to take care of the life-threatening problems first, and then use the time that's available to you to work up the rest of the issues. So, for example, a Mittelschmerz diagnosis is not life-threatening, and so you have time to make that diagnosis. However, ovarian torsion, pelvic inflammatory disease, or appendicitis, those are problems that you need to make a diagnosis more quickly on. The initial laboratory evaluation for pelvic pain includes such things as a pregnancy test, a CBC, and then the consideration of coagulation studies, especially if you're looking at pelvic inflammatory disease as a problem. Using an ultrasound or using a CT scan can help in making your
Pelvic inflammatory disease, usually caused by sexually transmitted infections, commonly gonorrhea and chlamydia. When the cervix becomes infected by an STI, it no longer prevents sterility but allows bacteria to invade the uterus, fallopian tube, and ovaries.
But one hint that women absolutely cannot ignore, symptoms of pelvic pain, lower abdominal pain, if they have painful sex or irregular periods, these are your body just screaming to go to the doctor and get evaluated, because they can be signs of pelvic inflammatory disease, which is basically infection in the inside of your body. It infects your vaginal organs, and it's an ascending infection. So it starts in the vagina, it goes to the cervix, it can go into the uterus, go out to the tubes, into the ovaries, can actually cause abscesses called tubo-ovarian abscesses, which involve the ovaries and the fallopian tubes. These things can cause infertility. They can cause pelvic pain. They can cause pain with sex if they're not treated soon. The most often cause of the pelvic inflammatory disease is gonorrhea and chlamydia, sexually transmitted diseases, but it can also be caused by bacterial vaginosis. So even just normal bacterial infections can cause this as well.
Dr. Lisa, this is one of those, often it is sexually transmitted, but this is one of those where if treated early, very effective treatment.
You can cure it just with antibiotics, and sometimes it's outpatient antibiotics, sometimes it needs to be IV antibiotics. So, but again, because of the sequelae, because it can cause scarring inside and cause problems with ectopic pregnancies, fertility, chronic pelvic pain, it needs to be treated.
Cause of PID. Primary untreated infections of chlamydia, gonorrhea, and rarely bacterial vaginosis, herpes virus, protozoa.
Pelvic inflammatory disease, PID, is infection of a woman's reproductive organs. Infection spreads upward from the cervix to the uterus, fallopian tubes, ovaries, and surrounding structures. Some of these conditions are also referred to as cervicitis, inflammation of the cervix, salpingitis, inflammation of the fallopian tubes, endometritis, inflammation present in the lining tissues of the uterus, and peritonitis, inflammation of the peritoneum, the membrane that lines the abdominal cavity and covers most of the abdominal organs. All of these conditions may be considered as specific diseases, but many investigators group them together as variations of PID, especially if they are caused by either chlamydia trachomatis or Neisseria gonorrhoeae. Bacteria can infect the fallopian tubes and cause inflammation, salpingitis. When this happens, normal tissue can become scarred and block the normal passage of an egg, causing infertility. But if fallopian tubes are partially blocked, an egg may implant outside the uterus and cause a dangerous condition called an ectopic pregnancy. An ectopic pregnancy can cause internal bleeding and even death. Scar tissue may also develop elsewhere in the abdomen and cause pelvic pain that can last for months or years. The two most commonly involved bacteria that cause PID are Chlamydia trachomatis and Neisseria gonorrhoeae, which cause the sexually transmitted diseases, chlamydia and gonorrhea. PID can cause a wide variety of symptoms. Some women can be very ill and have severe pain and fever. Others can have no obvious symptoms or even appear ill. Thus, PID is not always easy to diagnose. But it is important for women to seek medical attention if they have any risk factors for PID or symptoms of PID. PID affects more than 1 million women in the United States per year. Nearly 250,000 women are hospitalized annually because of PID.
Symptoms. Some symptoms include fever, infertility, abdominal pain of the right abdomen, painful urination, irregular menstrual bleeding, vaginal discharge with foul odor, vomiting, no symptoms at all. Diagnosis. There is no specific pelvic inflammatory test, but there are other tests used to make an accurate diagnosis. Tests include pelvic examination through ultrasound, C-reactive protein test, cholecystosynthesis, WBC count test, laparoscopic, microscopic examination, culture of vaginal and cervical secretions, blood tests, endometrial biopsy, physical examinations.
The female reproductive system consists of the ovaries, fallopian tubes, uterus, and vagina. These organs are vulnerable to bacterial infection, which can be caused by poor hygiene or by sexually transmitted diseases. Chlamydia and gonorrhea, for example, are caused by bacteria that enter the vagina during sexual intercourse. These bacteria multiply in the warm, moist climate of the vagina, causing inflammation, pain, and vaginal discharge. Left untreated, bacterial vaginal infections can spread to other internal organs. For example, bacteria may enter the uterus through the cervix. If this occurs, bacteria can infect the fallopian tubes, where the bacteria can continue to multiply and create scar tissue. From the fallopian tubes, the infection can also spread to the ovaries, as well as to other abdominal structures, such as the bladder, intestines, and the walls of the pelvis. PID is the term used for the generalized infection of the uterine lining, fallopian tubes, and ovaries. Symptoms of PID can include vaginal discharge, chronic pelvic pain, and fever. However, the most severe consequence of chronic PID may occur during ovulation, when an egg is released from a woman's ovary. The scar tissue left by the bacterial infection may completely block the fallopian tubes, such that the egg cannot pass into the uterus. The result is either infertility because sperm cannot reach the egg, or ectopic pregnancy, a medical emergency in which the egg is fertilized and begins to grow within the fallopian tube. If you experience any of the symptoms of sexually transmitted diseases, or PID, seek medical attention. Early detection and treatment is key to preventing unfortunate medical outcomes.
Treatment. Already had a gas. 2 antibiotics are used together to eliminate the various bacteria that could be present. Treatment usually lasts 14 days, but varies depending on the type of infections of the antibiotic use. Fixing 8,000 milligrams one-time dose. Doxycycline 100 milligrams BID over course of 10 days. If bacterial vaginosis is the cause, 5,000 milligrams of metronidazole BID for 10 days will also be added to the course of antibiotic treatment. Diagnosis: chronic pelvic pain, ectopic pregnancy, infertility. The more the woman has PID, the greater chance of becoming infertility can lead to death.
So today I'm going to talk to you about a disease that can be pretty high amongst teenagers. It is known as PID, or pelvic inflammatory disease. Now, I've talked to you a bunch about the importance of safe sex and given you details on different sexually transmitted infections. PID is one of the more serious complications of an untreated STI. It is basically an infection of the female reproductive organs, which causes irreversible damage to your fallopian tubes, your uterus, your ovaries, and can cause infertility. So, here's how it works. Basically, your cervix job is to prevent bacteria from entering your vagina and into your inside organs. Now, if the cervix is compromised, as in it is infected by gonorrhea or chlamydia, then it can't do that. That's when PID kicks in. So PID is basically if the disease-causing bacteria are let in through the cervix and touch your reproductive organs on the inside, that's when it can cause all this damage. Basically, untreated chlamydia and gonorrhea account for 90% of PID cases. So let's check our symptom tracker here. Painful urination, chills and high fever, nausea and vomiting, and pain in the upper abdomen. If you have any of these symptoms, go to the doctor, get tested. He'll give you some antibiotics to take care of this issue. Good news though, PID is completely preventable as long as you practice safe sex. That is, use protection, get tested for STIs regularly, and make regular appointments with your gyno.
Prevalence only found in women. 1 million women each year developed PID. Over 715,000 women in a year located United States have experienced an episode of PID. The more sex partners one has, the greater risk of developing PID. Due to the immaturity of young adolescent cervix, those aged under 25 are more likely to develop PID due to increased susceptibility to STIs. Women who those are at a higher risk. 1 in 8 women will get PID before age 20. Then 30% of women will become infertility after one episode. 18% of women develop chronic pelvic pain. The highest age risk is between 14 and 24 years of age. 116 women died each year from PID. Thank you.